Very good evening to everybody in this session of Divine School of Homoeopathy, a Thursday feast. I'm always happy to share something with all of you in on the Thursdays. Basically, I want to share few remedies which are generally overlooked in day-to-day homeopathic practice. And that's why today I have selected a remedy which is very useful in gynec practice, a Thlaspi Bursa Pastoris. I will going to share few cases and then I will explain the Thlaspi. A remedy generally considered to be a remedy of females, but it is not only a female complaints which are important. And that's why I will share my screen and we'll start with the session. So very warm welcome to all of you in this session. We'll start with the topic. The topic is my experience with the Thlaspi Bursa Pastoris. This remedy I have utilized in early practice too much. When I was attending my own hospital where many gynec obstetric cases were there, at that time I have utilized Thlaspi Bursa many times. When I started separate consulting room, there is a little bit limitation happen. But it is a wonderful remedy one should learn. Instead of going to the remedy first, we'll learn with the cases. I will share one case uh, which was which taught me a lot regarding the this remedy. And this is the case. That's all. Nothing more than that. Just go through what has been mentioned. A 48 years female. One of my students' mother was brought to me on 18th January 2019 for DUB with profuse leukorrhea associated. It is a diagnosed case of suspected malignancy, specifically of cervix, and posted for hysterectomy. But she was quite cowardice. She refused to go for hysterectomy, and that's why her doctor brought her to me. She had since 1 year she was suffering from this problem. The hemorrhage was profuse, dark clotted, lasting for 3 weeks, and made her anemic. Every period it used to last for 20, 21 days, 22 days, 23 days. And immediately, just a gap of 4 5 days, and immediately next period, she used to get the next period. And she becomes so anemic because of it. And every time the bleeding was associated with the severe hypogastric colic. She said that every time, whenever she used to pass a clot, she gets a crampy feeling. She has chronic profuse offensive bloody leukorrhea. That was another characteristic. She said that whenever white discharge has to happen, it is always blood tinged. And that was the thing because of which she was suspected a case of malignancy by her gynecologist. So that leukorrhea had one modality, it was before and after the menses. She became too indolent due to the weariness developed due to the blood loss. So weak, so fragile, so anemic. That was the thing which I have observed in that case. Her gynecologist explained that she is having cervical induration and the suspected malignancy, and that's why she advised her to go for hysterectomy. Her pap smear showed hyperplasia over there. When she came on 18th of January, she had menses on 3rd January 2019 and bleeding was continued. And she said that every time she used to get bleeding, it starts on first 2 days, 3 days, very small spotting, and then gradually it increases, and it reaches to its teeth, and then it becomes so profuse every time whenever she passes the clot, it is too painful for her. When I clinically examined her, pulse was 110. She was in tachycardia and her blood pressure was at lower side, 97/76. And she was looking tremendously anemic. So that's the case. Nothing more than that I got in this case. And when she came, there was bleeding which was profuse. She said that she has to change the pad every 2 to 3 hours in a day. This much severe bleeding was there. Already she went to many gynecologists and everyone asked her to go for operation, and she was finding it out uh, a medicine without going for a surgery, and that's why her daughter brought her to me. So what logic you will use if such type of case comes to you in acute phase? It is acute bleeding which you have to first tackle. There are many remedies in our materia medica which has this specifically this type of bleeding, but we have to understand every concept. What is there in that patient? What is that which will lead towards the remedy? Basically, she was from climacteric age. That was one thing. So if she is from climacteric, the logic goes with the lachesis also. It is dark clotted. Yes, lachesis is one important thing which can be when one can see. So that may be one important thought should be there. There are many thoughts, many remedies which has bleeding. But this bleeding was not active bleeding, it is a passive bleeding. I have not mentioned over there, her USG report showed it is just a bulky uterus. Bulky uterus has always a passive hemorrhages. Blood passes passively, not actively. If we think about the trillium pendulum, there is active as well as passive bleeding. Here it is basically a passive bleeding which used to happen, and when blood stagnates over there, and then when only used to pass that clot, then only the pain there used to be pain. So we have to think of a remedy which has a passive dark bleeding and which lasts for longer time of duration. And basically another thing, that patient is from climacteric age. So I have considered this remedy, Thlaspi Bursa Pastoris. And I have started, this is on the 18th January, I have started the treatment. These are two things which I always used to follow in my practice. I never give just medicine to the patient. I always ask all auxiliary measures associated with that. So she was too anemic. So instead of giving her blood point, it is always better to give her green vegetables, jaggery, the apples. These are dates. These are the entities which increases blood. Last time I have told you one important thing, that is the green leaves, which green grass therapy, that is also useful to increase the blood. In such types of severe anemic states, if patient requires the iron, you can give. Yes, if it is a supplement, tackle the condition. And then you have to think about remedy. My thought was to tackle the bleeding first. Then we'll go ahead. But first important thing, the bleeding should stop. So the remedy which I have considered was Thaspi Bursa Pastoris in 12C potency. It has been indicated many a times in mother tinctures, but I have never used it in mother tinctures. I used to use it 12C, 30 or 200. But generally 12C is a better potency to start with in such types of cases, along with biocombination number 15. One might think, why biocombination number 15? Biocombination number 15 is a very important combination which is useful basically whenever the such types of menstrual problems are there which are related with the DUVs. There are if you'll go with the ingredients of the biocombination 15, There is calcarea phos, which takes parts in the formation of a blood as well as in clotting process. Parum phos, inflammatory process. The first stage of inflammation is covered. Kali phos relaxes the patient. It is a very important remedy which tranquilizes at the same time. It relaxes the mind. It relaxes the muscles also. Many times the neuralgia, pain can be stopped with the Kali phos. Natrum phos, if it is a good remedy to tackle the bleeding, the phos elements always are useful in order to tackle the thing. And natrum self is there being an antipsychotic remedy which covers the deep action of this biocombination 50. So generally, whenever you have pathologies related with the menstrual complaints, think about the biocombination 15 and you can repeat it. So I have repeated both the remedies, the Thlaspi Bursa Pastoris as well as the biocombination 15 twice a day. And I have asked them to call me. After third day, there was a call from her that bleeding stopped on third day after starting medicine. And when she followed up on 2nd of February, her appetite improved. She looked quite fresh. Basically, the clinical signs were good. Her blood pressure was raised, 110/82, and pulse, the tachycardia reduced. That is a good sign. If tachycardia gets controlled, it means that now circulation is improving. That is a good sign. So I have stopped giving the biocombination 15 because there was no more bleeding. I have continued with the remedy in the same dose. And just after 15 days, I observed her, how she is. She got another menses on 5th of February. And menses lasted this time only for 5 days with very less dysmenorrhea. And she was quite happy due to the great relief which she got with the help of this remedy. Appetite improved, her pulse still came down 82, her blood pressure was maintained at a normal level. And I have added, or in fact, I have increased little bit potency. And when I considered this is the remedy which is working, I understood the depth of the remedy. I will going to teach you this remedy. This is not a remedy which is acutely acting only. This remedy covers the psychosyphilitic miasm, the cancer miasm. And that's why it's a deep acting remedy which works at the pathologies also. So there is no need to add something else in that. So this is very important thing one has to understand. So there is no need to go for any another constitutional or etc. This is the remedy which worked for her. After 6 months, this follow-up is there on nearly about a year follow-up. 6 months later, 20 July 2019, she recovered completely from her problem. Her DOB as well as uterine colic stopped, the anemia recovered. And she was continuing with follow-ups in between and she was happy. On 9th May 2020, she never had menses since last 6 months. Menopause started and there were no complaints. So this is the remedy which one has to understand. I will going to teach you this from different angles. Now we'll see another aspect of this remedy and which is missed by many people. Case number 2. This was again a 48 years male patient came to me on 15 June 2016 for severe hypogastricemia due to passage of copious brick dust sediments in the urine with very severe crampy colic while passing the urine since last 1 year. He was seen by a surgeon who prescribed him some Ayurvedic medicines which worked for some time. He used to pass profuse urine with very strong smell, and during consultation he was continuously complaining about his disease. He was in a confused state a lot regarding the treatment of his disease because everyone was telling him something else and he was in a confused state what to do and what not to do, and was continuously changing the treatment. Many doctors he has changed. When I asked why you are continuously taking medicines from different doctors, he simply told that I don't understand what to do. And when I started overlooking this problem, this was his sentence. When I started overlooking this problem, I felt that it started increasing. So he says that when I tried to avoid the looking towards the problem, it aggravated my problem. His urine test showed many crystals of phosphates. So see, again, a very important thing which you have to take into consideration. Generally, we think the sediments are there in the urine, then patient is having colicky pain in lower abdomen. We generally think of the remedies which has such types of sediments like sarsaparilla, like lycopodium we used to consider many times in such types of cases. Many times we consider Berberis vulgaris as a remedy. So many more remedies comes in our mind. But whenever there is a confusion, always go with the basically go with the repertorization. So I used to go with the repertorization. Whenever there is any doubt, I used to find it out what is there. What are the mentals which you observe in this case? There are two important things which I have observed. That first important thing that he was continuously complaining and complaining, doctor, whether I will settle, how this problem will be solved. I'm absolutely disturbed by this. And he used to complain about his disease continuously. That was the first thing which I have noticed in this case. And second important thing which I have noticed is his confused state regarding his disorder. Third important thing that he said, he answered that when I started overlooking this problem, I felt that it has started increasing. So these are three important things which I look in this case. And then the particulars are there, many more particulars. So I have considered all things and I repertorize these things. So complaining conditions, illness about one's. Then second rubric which I have considered, confusion of mind, closing eyes aggravates. Then third thing, the urine strong odor which was there. Urine sediment brownish reddish, sediment bloody, sediment red blood color, sediment phosphates increased, and urine is profuse and increased. These were the rubrics which I have considered. And to my surprise, the Thlaspi was there. The close remedy was the phosphorus, nitric acid, sepia, but Thlaspi through and through, it was there. And that was the thing which was very much necessary in such types of cases to differentiate or to find it out right remedy. Repertorization many times helps. And specifically, if you go with the particulars, considering either complete repertory or if you don't have complete, you can utilize the Kent also. Many times you get a very proper remedy. So through and through, the philosophy was there. So I have started with the my homeopathic management on 15 June 2016. Auxiliary measures, I used to ask every patient who is suffering from calculi, avoid the milk, tomatoes, the spinach, the high protein diet, all those things, all those stuff which increases the crystals over there. And I ask them to take plenty of fluids, plenty of water. And I have started same remedy in 12C potency. Only that remedy, nothing I have added because it was through and through the case was very clear. So I started with this Thlaspi and I want to check at that time because I have not utilized for urinary complaints before that. I have utilized many times for gynecobstetric troubles, but not for this specific urinary complaint. So first time I have utilized this remedy in 12C potency. And this patient, after 15 days when he returned, he was absolutely happy. Day one, there was profuse discharge and many crystals have been passed. And thereafter it stopped. And thereafter the urine was very clear. I have repeated it in 30 potency also for 15 more days. And this patient completely recovered from his problem with this single remedy. So this is one more remedy one should not forget for urinary troubles, which we generally consider only for females. So we'll just see what this remedy is. So Thlaspi Bursa Pastoris, it is also called as shepherd's purse. That is a common name. It is also called as Capsella Bursa Pastoris. This is name shepherd's purse is because of its triangular flat fruits which are there, which are purse-like. Is a small annual and flowering plant in the mustard family. This is very important plant which you can observe that these are the photographs of this plant, and see this plant generally is very useful even in if you make a juice of it. Robin Murphy in his keynotes have mentioned that this herb is used for as a fresh juice in such types of uterine complaints or urinary complaints. When I read the J.H. Clark has given many things. First important thing, what I like is the clinical aspect which he mentions to start with the remedy, and that defines the action of the remedy. See how many pathologies which it covers: the abortion, hemorrhage after, dropsy, dysentery, dysuria, fibroma, gallstones. See, this is also useful for gallstones, gonorrhea, hematuria, hemorrhages, leukorrhea, liver affections of metrorrhagia, ranula. What is ranula? Many times it's problem. That's why I have written there. Is a mucus extravasation cyst involving sublingual gland and is a type of mucocele found on the floor of the mouth. That is ranula, generally at the base of the tongue. Renal calculi, and not only renal calculi, there is strangury. While passing the urine, there is strangury. Uric acid diathesis. See, this is again a psychotic element which is there in this remedy. Uterus hemorrhage is from affections of cancer of uterus, Whitlow. It is an abscess in the soft tissue near the fingernails or toenails. It's called as Whitlow. So see, this remedy has a wider use. We generally never consider all those things, but those are there. Not a remedy only as a hemostatic, but it is a remedy useful for pathologies also. I have considered only two things from class Materia Medica or class dictionary, that urinary organs, what are the features, and from the female genital. In the urinary organs, what he mentions is hematuria, urine burning passing frequently of a strong odor. There is a copious discharge of urinary sand, increased flow of urine, relief of dropsy. This is again very important thing which you can consider. Renal calculus, very important remedy. Increased quantity of urine with brick dust sediment, strangury after accouchement, the dribbling of urine, dysuria of the old persons with dribbling. So this is very important indication which we have to take into consideration regarding Thlaspi instead of just looking towards the gynecology. Female sexual complaints in the Clark's dictionary, what he says, sexual excitement, there is a metrorrhagia with uterine colic. In hemorrhagic chlorosis, see, because of loss of blood, the anemia develops. This is very important remedy. In sequelae of abortion or labor. So after abortion, after labor, if the metrorrhagia persists, Thlaspi is one of the important remedies. Premature menstruation. The first day she hardly had a show. Second day, hemorrhage with severe colic and expulsion of clots. Flow last 8 to 15 days, left a state of exhaustion which was not recovered from the before the next period came on. This proved very profuse. Next, less so. Hemorrhages with violent uterine colic and cramps. See, lot of uterine colic, spasm, cramps, consequent on abortion at the critical age with cancer of cervix and fibroids. See, this is one more thing. Here, two important things. Psychotic miasm dominates over there, as well as the cancer miasm, psychosyphility. Too frequent and copious menstruation, especially in persons of relaxed constitution. Hemorrhage is dark with clots, the suppressed and checked menses. Menses delaying from inertia, that is very important thing. Leukorrhea, which is bloody, dark, fetid before and some days after menses, which were profuse and dark. Hemorrhages after abortions, following an attack of jaundice. After menses, discharge of brownish green blood with obscure abdominal pains. Cervix is swollen and soft but not ulcerated. Thlaspi Bursa Pastoris, 6 gave immediate relief. Mother tincture and again 6 completed the cure. That was experience mentioned by Clark. So this remedy has a lot of things. If you go with the Borik's Mathematical, he has mentioned these things in the first paragraph. So this is what same thing which you can find it out from the Clark's Mathematical. But few things which I want to add over there, which are very important in what Borik mentioned. It is last sentence in the urinary complaints often replaces the use of catheter. See, this is the one sentence one should not forget. Many times the old persons who used to remain, there is a bladder tone which is lost and they remains, they passes urine off and on, and sometimes there is obstruction and problem is there. In such cases, it is the remedy which replaces the use of catheter. Many things which are already mentioned. There is chronic neuralgia. It is anti-hemorrhagic, anti-uric remedy, uric acid remedy. That is the first sentence mentioned by the Bori. Then he has mentioned about the chronic cystitis. That is another pathology, and phosphatic urine. So one has to understand the Thlaspi, and you have to compare it with trillium. Trillium pendulum, yes, definitely the fibroids are there, the tumors are there, the pathologies are there. Trillium, there is active bleeding. It is basically increased blood flow because of which bleeding happens. In case of Thlaspi, it is passive because just a uterus is relaxed over there. That causes a bleeding. Millefolium is another remedy which Boris says that compare with it. Two important single remedy rubrics are there in this Thlaspi. Mind walking must morning. That is one important rubric, single remedy rubric. And walking must far distance. That is another rubric. That is another important feature which is there with this remedy, a single remedy rubric again. So these are two important things one should not forget. There are few important mind rubrics are also there. Just go through them. First is complaining conditions, illness about ones. There are 9 remedies. Second important is confusion of mind. Closing eyes aggravates. The third, excitement, excitable, anger, vexation with. So there is excitement with anger with vexation. Then exhilaration after the sadness. So two alternating states. There are only 2 remedies mentioned. Hysteria, specifically in uterine complaints. This is one important remedy where 31 remedies are there. Then patient becomes indolent, aversion to work with weariness. Thlaspi out of 8 remedy. Restlessness, nervousness in the afternoon. Thlaspi out of 37 remedies. And last, there are only 2 remedies: suicidal disposition, alone being aggravates. That is the Thlaspi. So these are few important mental rubrics. When we read the Mathematica, we never get mental state of the Thlaspi. But if you go with the complete repertory, there are many more. But these are very important where there are very few remedies to compare. So when we have to understand remedy, we have to take into consideration all the aspects of the remedy, which defines you and which gives you a fixed picture in your mind. So one should not forget this Thlaspi whenever there is passive hemorrhage, whenever the bulky uterus is there, whenever the cervical induration is there, cervical malignancy is there, whenever the fibroids are there. This remedy is a wonderful remedy. At the same time, in urinary complaints, whenever there is a brick dust sediment, that is very specifically, it looks bloody, it looks blood tinged, it looks brownish, and many a times these people passes lot of sediments in their urine continuously. There is one more thing, it is always a profuse urine. So these things defines you clearly the remedy. So we have learned many aspects about it. So this is the remedy one should not forget in practice. So we have learned about the exactly what Hahnemann wants to explain about this remedy. Clark has mentioned very clearly. My suggestion is that you go through the Clark's dictionary, because in earlier part, before giving the Materia Medica, he has mentioned many cases also. So this is a wonderful remedy one can use in daily practice, because such types of cases are always there. Whenever the female homeopathy is there, they always get such types of. So thank you being there. Many participants who have joined today for this session. Thanks a lot for attending such session, and we'll continue with this Thursday series. Do subscribe our YouTube channel, those who have not yet joined the Divine School of Homeopathy, so that you can get many more thing over there. Many sessions I have taken, more than 430 videos are there. Then this is a Divine School of Homeopathy, is a platform for everybody to develop. Just pay INR 500 once by GPay or PhonePe to 9890168872. So you can become a member of Divine School of Homeopathy, and you can learn a lot in these sessions. So thanks from the bottom of heart. Many people who have joined in today's session. Satyanarayan ji sir, their work, Dr. Varke sir, right from he is in Canada, still he joined our sessions. So thank you being there. We'll have again a wonderful session whenever the time permits. And thanks everyone. So we'll meet next Thursday, probably with some other remedy, and daily from Monday to Friday with the our organization. Which biocombination should be used in renal stone? Generally, it is for renal stone. You must think about natrum sulfuricum, but for to tackle the pain, MacPhos is a very important remedy. To to stop that spasm, MacPhos works beautifully. Natrum
Sir, one
sulf is
doubt.
a psychotic remedy which covers the hydrogenoid constitution, and that is useful in such types of cases.
Sir,
Any
one
other?
doubt, sir.
Yes,
One doubt, sir.
yes.
What is the difference between active hemorrhage and passive hemorrhage, sir?
Active hemorrhage is arterial, where arterial pressure is increased. It is fresh blood. Bright red blood is there in active hemorrhage. It is arterial. Passive is that there is no, the blood is not arterial directly. It is saturated blood passing, oozing from the there, as just because uterus here, it is just relaxed. It is what you can say, bulky uterus, which is absolutely relaxed, and muscles are not getting contracted, and because of which blood oozes. That is a passive bleeding. So it generally, passive bleeding is always dark in color. It is dark in color, it clots, and it shows uh, the clots are thrown away. In active, it is bright red, so you never get clots over there. It is arterial bleeding, fresh, phosphorus, arterial bleeding, generally very clear cut. So it cecal cord, where there is a not active bleeding, it is passive bleeding. It is always a dark colored, oozing continuously. So that is the difference between active and passive.
Thank you, sir. Thank you, sir.
So thank you everyone. We'll meet again, and thanks a lot for everything.